I'm Kelly Hill. I'm a sports medicine fellowship trained orthopedic surgeon at Tulane. I was an athlete in college and I had an issue with my hip, and that ended up after a lot of physical therapy and other treatments needing surgery. And I learned a lot about myself and my surgeon in that process and sort of saw how I would want to be treated as a patient. And that really has informed a lot of how I treat patients who come into my clinic. I did my medical school at Tulane and got to know some of the orthopedic surgeons here really well, continued on and did my residency here as well. And I think that that's a pretty world-class training with some of the physicians that I now get to call colleagues. Then I spent a year in Nashville doing a sports medicine fellowship where I specialized in rotator cuffs and knee patellar alignment issues, and especially some hip arthroscopy with, in my opinion, some of the best surgeons that are out there, including Dr. Bird, who invented hip arthroscopy, and then Dr. Sullivan, who I trained with there. I really like orthopedics specifically because you can demonstrate for a patient what their problem is and how we can work together to solve it. I see a big range of conditions, and that can go from rotator cuff pathology to knee issues, and especially I have an interest in hip preservation. I like to see patients all the way from young active athletes to people even in the pre-arthritic stage for their shoulders and hips. Patients come into my office with the complaint of hip pain, and a lot of time that can be a wide range of things based on a difference between what a patient considers their hip and what we know is the actual hip joint. And so I take my time taking a history with patients to understand if a lot of this is happening with their back or the side of their leg, or if there's any nerve symptoms involved. And I think it's really a key part of finding out what the right diagnosis is so that we can get them participating in physical therapy and maybe even a diagnostic injection to see what the next step is towards getting them back to whatever they want to be doing.